Next topic is normal biological aging. So in that we can see age related changes which is happening in the body systems. So these all considered as normal biological aging. So the loss of some body cells and reduced metabolism in other cells are the real characteristics of aging. That is, while we age, some body cells function itself will go, or the body cells will become damaged. In other way, the metabolic activity will be reduced by some other cells. So these all processes cause a decline in the function of the body and changes will happen in the body. So while we compare the age group 60 and 20, the organs which we have, the heart, lungs, kidney, or any other organs, will not function same in these two ages, right? So in age 60, while comparing to the age 20, these organs will be less efficient. So it is important for a nurse to recognize the gradual changes in body function that normally accompany aging. So we are going system-wise changes. So we can find out all those things, declined functioning of each system separately. So starting with cardiovascular system. So what we can see here is the heart rate will be decreased. Slower heart rate, mainly due to reduction in pacemaker cells. So pacemaker cells will be reducing, and of course the heart rate is being reduced, or cardiac output will reduce. Due to aging, there will be decreased contractility power of the heart. Even the coronary artery blood flow will be impaired. So when coronary artery blood flow is being impaired, the heart is not receiving blood. The heart cells are not receiving blood. Less oxygen and blood supply to the organs, and so that it affects the function of organs. So when heart is not receiving blood, the heart is not able to function properly. So what is the actual function of heart? Heart's function is to provide blood, oxygenated blood to the body. So that function will go down. So and also diminished ability to respond to stress. So when a stress occur, for example, stress in any manner, what happens when tensions arise, our heart rate increases. Here the ability of the heart to respond to the stress or a physical activity diminishes. Other changes: altered preload as well as afterload. So increased rate of atherosclerotic plaques and increased blood pressure. The valves of the heart will get thickened and become stiffer. And we can see a slight increase in size of heart, especially left ventricle hypertrophy. So the heart wall will get thickened, so the amount of blood that the chamber can hold may actually decrease. So during diastole, the amount of blood which is receiving is very less because the heart wall is thickened, as well as the heart valves are thickened and stiffer. So under normal circumstance, the heart continues to adequately supply oxygenated blood. But in aging, if any workload is increased, the heart is not able to tolerate. For example, if the aged person got any illness, any painful stimuli, any emotional stress, injuries, or extreme physical exertion. So in these stressful situations, the heart is not able to tolerate the workload. And some more changes: reduced ability of the heart to quickly increase its rate in response to an emergency because of thickening of heart valves, left ventricle as well as aorta. So all these changes will decline the functioning of the heart. So more irregular heartbeats can be seen, arrhythmias, which will obviously lead to poor oxygenation of the heart. More visible superficial blood vessels of legs. So in aged persons, we have seen there are superficial blood vessels which is very much visible. Murmurs can be expected in old age. Diastolic murmurs are common. So weakened pedal pulses and colder lower extremities, that is due to decreased blood supply. So these are things we can see. Cardiovascular changes. Cardiovascular changes. So here I have already also added blood vessels also. So in case of arteries, arteries will get thickened, stiffen. Mainly the large arteries are being affected, mainly due to deposition of collagens. So in the case of smaller artery, the thickening as well as stiffening is minimally occurs, but the ability to dilate as well as constriction abilities diminishes in smaller arteries. And regarding the veins, so age-related changes are minimal in these veins. If you are taking aorta, aorta will become thicker, stiffer, and less flexible. So what happens is the resistance, the pressure will increase, leads to left ventricular hypertrophy. How left ventricular hypertrophy occurs? How? Okay. So the left ventricular hypertrophy, the left ventricle is the one which is ejecting the blood to the aorta. So by aorta here is thicker, thicken as well as stiffer. So it is not able to receive the blood which is ejected from the left ventricle because of the high resistance in the aorta. So what happens due to overworking of the left ventricle in order to push blood to the aorta? There will be hypertrophy of the left ventricle. And there will be increased large artery stiffnesses. And if that happens, it will lead to fall in diastolic blood pressure associated with rise in systolic blood pressure. And regarding the baroreceptors will less sensitive with aging. So tell me what is baroreceptors, where all baroreceptors are located. So when baroreceptors are, you can message me, okay, baroreceptors are not functioning means it will lead to, it may be a reason for orthostatic hypotension. So other hematological changes is a decreased in total body water. So total body water content will be decreased, and eventually there will be hypovolemia and also can lead to hypertension. Blood volume therefore decreases, more prone for dehydration also. The number of RBC, HB as well as hematocrit reduced, but not that significantly, but while comparing to the young age, it reduces. Regarding the WBC will stay in the average level, but if you are taking the lymphocyte alone, the lymphocytes decreases. So the risk for infection increases. So overall the cell counts and the parameters are not significantly changed while comparing to the adult life. But when we are checking the bone marrow cellularity, that will be decreased moderately. So if you are taking a iliac crust biopsy, 30% of cellularity can be seen. So when comparing to the young age, it is very less. But it is not unusual in an older person. Older person, that is expected. So these all are the changes which we can see in the cardiovascular system. So moving to the respiratory system. So here, so the respiratory system we can see in next video. Okay, already 8 minutes.